Chapter 3 Directional Terms, Positions, and Imaging. In planes of the body, there's an imaginary line that basically slices the body potentially from the top and dividing it in top and bottom, or right and left sides, um, or in another direction. But it's an imaginary line that divides the body. Seen a lot of times in diagnostic imaging and in surgery purposes. The axial plane is a horizontal, divides the body into superior and inferior part halves, and this then means you have a top and bottom half. Coronal is a vertical plane, and it passes through the body from side to side and divides it into anterior and posterior, which is front and back then. And a mid-sagittal is a vertical plane, and it goes from front to back in the midline, so it divides it into right or left side. And parasagittal is a vertical plane, goes from front to back and divides it into unequal halves. So it's still, it is a sagittal type plane, but it divides it unequally in this case. Sagittal, vertical plane passing through the body from front to back, divides the body into right and left sides. Um, and these last three are just somewhat modifications of each other. In lesson 2 of this chapter, we'll look at the definition, pronunciation, and spelling of terms used to describe body positions and in diagnostic imaging terms. Also look at the interpretation of some of the abbreviations in the chapter and apply the language in a clinical context as in a case study. In body positions, this is usually positions we would put a patient in for certain types of examinations or procedures or those kind of things. But it's changing the patient's body position. These are lateral recumbent. That would be lying on their side, and it might define right or left. Orthopnea position, this is a patient who might have difficulty breathing, so they would have them sit upright in a chair, or they could sit on the bed with a pillow behind their back to support them. And then they would have the ability to lean forward over the pillow if they needed to. Prone position is lying on their abdomen, and since this is face down, they often will allow them to turn their head to one side. And then the Sims position is lying on their side, leaning more towards the stomach, with a knee drawn up toward their chest, and the arm behind their back parallel to their body. And this is one that's used sometimes for certain procedures. Here's a couple examples of diagnostic imaging terms, and they are built from word parts and not built from word parts. Those built from word parts include radiograph, which is a record of x-rays, and a sonogram, which is a record of sound. Those that are not built from word parts include fluoroscopy, which is, in these procedures, they are imaging or somewhat like taking a movie of a body area as it is moving. Basically, we're picking up the movement in this case, and a lot of times there is a dye or a contrast agent used with those. And then magnetic resonance imaging. It's computer controlled magnetic fields, high strength, and it produces slices of an image, and it's used a lot of times for looking for particular swelling causes or infections or tumors or herniated disc or soft tissue type things. A little earlier, we had the abdominal pelvic regions, and now this is the abdominal pelvic quadrants. Quadri means four, so means that the quadrants are divided into four parts. They're divided into upper and lower and right and left. So you're always referring to these from the patient's right or left, or upper or lower. So it's from the view of the patient, and it would be, if you look at a patient, this would be opposite what our body would be. So we have the right upper quadrant, and the abbreviation there is RUQ, and these are all pretty commonly used in healthcare. The left upper quadrant is LUQ. RLQ is the right lower quadrant, and LLQ is the left lower quadrant. And some abbreviation examples include INF, which means inferior, MED, which means medial, and that also refers to the metal when we talk about medial. CT is computed tomography, and US is ultrasonography. And these, again, especially these last two, are pretty commonly used. And as before, we're going to look at a part of a case study. The patient presented to her physician with pain in her right lumbar region. So lumbar regions is your key term there. And right unilateral leg pain. The pain was felt in the posterior portion of the leg and radiated to the distal lateral portion of the extremity. There was some proximal muscle weakness reported of the affected leg. A lumbar spine radiograph was normal. If the pain does not respond to anti-inflammatory medication, she will be referred to an orthopedist. So you want to focus there on the bolded print.